Hi, everybody.
Hi.
We are joining everybody here. It looks like we got quite a few people with us. It looks like Lovey. Am I saying that right? I hope. And from
Lovey.
Greenwood, South Carolina. And we have Erin. Erin's part of the ProCare health team. And
Mm-hmm.
we have Janine, and she's joining us from Michigan. And she's an advocate for
Hi,
ProCare.
Janine.
It looks like we got Gloria. And then we also have some other people who've joined that hasn't yet said hi, but we want to say hi to all of them as well. So we're so glad you guys are here. Tonight we're talking about all about vitamins post bariatric surgery. So we're going to try to make this topic fun. I mean, to me, whenever I was teaching this materials before I started with ProCare, I honestly, it was one of the most overwhelming subjects because it's just so much. But we're
It
going to try to make it
is.
easy and simple. And we got some great handouts for you guys. Handouts can be accessed right here at the very bottom. I don't know if you guys can, there should be a little link. It says support group handouts. Click here. It'll take you to a page. And when you get to that page, you'll look for the all about vitamins topic because there's lots of topics on there, and then you select that, and there's a couple. I think there's three handouts, so you don't have to access them right now. We'll be showing them to you, but if you'd like to access them after the program. So we're gonna just get started, and so I'm
Oh,
gonna turn things
well,
to Brittany just for a second for her to say hi.
hi. I actually wanted to say something real quick before I do my intro. So we did have a couple people email us saying that they're not comfortable being on camera, and that is totally fine. We hear you. It's all about your comfort level. We're not going to make you do anything you don't want to do. This whole idea of a support group is to support each other. So if you're not comfortable, then that's fine. But I will say that if you get an invitation to come on screen, you still have the ability to decline. So it's all up to you. I don't know if we're going to invite anyone on screen tonight. Brenda, did you have that in mind?
We'll see how much time we have.
Okay, so we,
Yeah.
we might, but I didn't want anybody to be uncomfortable or anything. So I wanted to say that from the very start that it's all up to you. We're not gonna just randomly put you on screen. So, but anyways, I guess I cannot see other participants, so I did not know we are on camera. Okay with me. No, no one's on camera right now. It's just Brenda and I. That's what I was saying. So, the only way you would ever be on camera is if you got an invitation, which it'll pop up on your screen. It'll be like a pop-up that'll pop up, and you'll have to click either accept or decline. So I just wanted to make sure that everybody knew that so they were in their comfort zone. Um, but yeah, so I'll jump into a little bit about me. Sorry, I was reading Janine's comment. And then we can get started because we already almost are like 5 minutes. So I'm Brittany, and some of you might be familiar with my face. If not, my name is Brittany. I do these support groups with Brenda. We do also weekly live events too. And we'll show you guys the platform that we use for that after we're done with the presentation tonight, in case you're curious and you want to learn more, or you maybe want to see some of the past events that we did, because I personally think it's a really good resource, but I'll let you guys decide that. But I've been with ProCare since about August or September, so I am a little new to the bariatric community, but I've loved it. And to be honest with you guys, I do a lot of different uh, pieces with this job, and my favorite by far are these support groups. This is my favorite thing that we do. It's the best, honestly. Uh, so yeah, I guess I'll hand it off to Brenda. Oh, I remember there was one more thing I want to say. So we were talking about how overwhelming vitamins can be for weight loss surgery patients, and I had no idea how many, like what the recommendations were and everything until I started this position with ProCare Health. And even for me, it was overwhelming at first. So I'm really excited for tonight's topic, and I think that you guys are going to get a lot out of it. So,
Yeah. Well, at least we hope so.
Yeah.
We hope you get a little tidbit here and there. And um, so I'll introduce myself too. For those of you who don't know me, my name is Brenda, and I have been with ProCare Health for several years. I've known them for a lot longer than that. I worked at a bariatric surgery program as a nurse coordinator for the program. And in that role, I did a lot of helping people prepare. Basically, in the beginning of that program, it was a startup. So by the end, we had probably about 10 employees, but kind of did everything from calling insurance companies to doing all the education to learning myself a lot about bariatric surgery. So that's a little bit of my history. And I worked with ProCare. We sold their vitamins out of our clinic. That's how I got to know them. We also had other vitamins too, other companies that we worked with, but I always had the strong connection with ProCare. I love their stuff. Their vitamins are inexpensive and just really easy. And so, anyways, that's where that relationship began. ProCare is our sponsor today. I also had weight loss surgery myself. I'm a patient. I had the sleeve gastrectomy back in 2013, and my journey had taught me a lot and helped me with understanding, the people that I was working with, like patients and things like that, helped me understand that a little bit more. And as far as the other pieces, I love personal development. It's always been a passion of mine, probably more on the side than anything else, but I try to bring it into my work. So studying that, I went to be a life coach because of that. So try to bring that in. And then also have a certification through Healing Beyond Borders in holistic health. It's a healing touch practitioner is what I am. So just all of those little pieces trying to bring together, from education in the bariatric world to personal development to just helping be a little bit of a coach, to try to help you guys. So hopefully we can bring a lot of pieces together. And I'm so happy that all of you are here. Continue commenting. We have a chat box. I don't know how well it's accessible for you guys, but it should be. It should just be a chat box that's open throughout the program. Please feel free to make comments over there. Say hi to us. We love interaction. You guys are amazing. This is why we do it. These are all accessible after we get finished too. These are on replay. So this is going to be video taped or recorded. And so feel free to go back if you have questions. Our handouts, I'm going to let Brittany put the link, if you don't care, Brittany. Put the link
not at all.
For our handouts. You have a little link that should be below here that says support group handouts. Click here, but we'll also put it we'll also put it after the program. If you stay till the end, we have a special little surprise for you. It is a discount code for those of you who are joining us. So we want to give you a little gift. And I'm gonna just start in. If that's okay, Brittany? Are you?
Yeah, you're fine.
Else?
I'm just gonna mute myself temporarily while I'm typing out the links for the handouts because I don't want people to hear me.
Okay. So again, feel free. What we'll do is we'll allow people to comment, and Brittany will kind of share with me anything that's commented. Now, there's also an ask a question box at the bottom, and please, please, please feel free to use that. What we will do is at the end, we'll take a little bit of time and we'll go through all the questions that are asked one by one. And we can actually mark those on the video, like put a little timestamp so that you can go from the ask a question directly to the timestamp, so that in case you have to leave early or whatever, that you can go and access that pretty easily. So to kind of begin, I'm going to be sharing my screen, and I have a little PowerPoint presentation, but I also have some handouts. So stay with me here. You're going to see me kind of sharing my screen for just a moment, and you're going to see me going into a PowerPoint. Can you see that, Brittany?
Sorry, I'm muted. I was muted still. Oh. Yes, I can see it.
Okay. You're going to see some little slides over here on the side. Just kind of disregard that. It helps me with kind of knowing where I am and navigating a little bit. But you should be full screen there. And basically today, again, we're talking about vitamins. And just basically, we're talking about the recommendations the research that I found was through the American Society for Metabolic and Bariatric Surgery. They're the ones who help write guidelines for programs. Now, I was a little bit nervous about putting this information out there for the simple reason that, a lot of programs out there have very different recommendations. So I want you to be aware, okay, that whatever your program tells you, please listen to that. Please be advised that if it's different from what I'm telling you, there's nothing wrong or right about it either way. What I'm just saying is, the research that I got was from the American Society for Metabolic and Bariatric Surgery, but every program, the surgeons, the dietitians, the nurses, and all of that, they may have different than what I'm telling you. But just be aware of that, okay? That there are a lot of differences between programs, and it comes from experience. They may have found ways to tweak things or do things different. So what we're also going to be doing is describing the functions and risk associated with vitamin use and non-use. We're going to be talking about ways to overcome barriers and compliance and taking vitamins. And I'm going to try to make this fun. I know these are pretty heavy topics. And then developing a vitamin maintenance plan that works, that helps you, basically, that is easy for you to take. Because we're going to talk about the reasons, the barriers, because there's a lot of reasons that people don't take vitamins. And when you're taking them, it helps increase your immune system, increase your energy, your vitality. It helps your organs possibly function more better, and enhances that and enhances your mood. So that's why we're here and we're talking about this. And then the next thing is we're going to kind of talk about we're going to talk about the viewpoint of the ASMBS that I talked about, the recommendations for vitamin supplementation. And the main things is the multivitamin, B12, calcium, iron, fat-soluble vitamins, and B complex. And again, this is just disclaimer again that it may differ from program to program. So I'm going to stop sharing for just a second, because what I'm going to have to do is get back online and then go to the handouts. So let me do that. The first handout is that recommendations. Can you see that, Brittany?
Yep.
It says recommendations for vitamin supplementation.
It is. I will say it's a little small, so you might want to zoom in just a little bit so
thank you for
our
saying
audience
that.
can see it.
How is that?
I would zoom in just one more. That's a lot better. Okay.
Okay, thank you. I'll kind of bring the page down. So these are all available for you on the link that Brittany shared. We'll share it again at the end, just so that make sure you have access depending on when you're joining us. So the very first thing is a multivitamin. And I'm not going to read this whole sidebar conversation over here. This is going to be accessible for you afterwards. Our focus is going to be depending on what surgery you had, whether it be a bypass, sleeve, a lap band, or if you've had something like a bilipancreatic diversion or a duodenal switch or a SATI. This is going to be the column you're going to look at right here. Okay, so if you're looking at this column, the recommendations, and if you're looking at this column, the recommendation. And then there's a few comments here. So basically, most programs recommend a bariatric multivitamin. And you're going to see me focusing on ProCare because honestly, it's just easier because there's so many different vitamins out there. Whatever you take and whatever works for you, I'd say go for it because everybody's different. There's no one size fits all with these things. So I'm not trying to push ProCare Health by any means. I just want you to take what works for you. But for ease of presentation wise, that's what I'm going to be kind of referring to. So some multivitamins are twice a day, some are 3 times a day, some multivitamins are 4 times a day. ProCare Health, they have a couple variations. They have a 1 a day, and then they also have chewables, which are a 1 a day, and then they have a couple variations that are twice a day, and we can talk about those later. But whatever on the back of the multivitamin, that's a bariatric multivitamin, it should tell you the dosage and the amount and how often that you take it. it is recommended, the American Society for Metabolic and Bariatric Surgery, that you take a bariatric multivitamin as opposed to an over-the-counter. Now, some programs may tell you, differently, and that's okay. Recommendations vary again. So, first of all, multivitamin. And when you're looking at that multivitamin, this is what you're going to be looking for. So, you're going to make sure that it has folic acid in it, it has zinc, it has copper, and it has B1. And I'm not going to read all these numbers because I don't want to overwhelm you. This is just a table to refer back to. Okay, so you can take the back of the bottle, and you're not going to be able to see this because this writing is small. But like, let's say you're looking at your bariatric multivitamin. On the back side, it's going to have the names, and then it's also going to have the milligrams. The percentages, I would kind of, we have a whole nother program on percentages. It was with Katie Chapman, an interview on our ProCare Health channel. We'll share the link to that, but here in a little bit. I don't know if you want to do that, Brittany.
Katie's she's a registered dietitian too, so she just explains basically the new what is it? The new numbers. I have
the new recommendations on percentages, daily values, and that has all changed. So you used to be the program I work for. We just say, take 200% of the multivitamin, and you're good to go. But that's not really the case. What I found out after I started working in more the vitamin world, the percentages are based on other things other than that. And that's a whole nother deep conversation. But we do have that information available as well if later you want to investigate that. Like I said, we'll share that link. But pay attention to the milligram dosages, okay? So that's the first thing. So multivitamins. Second thing is B12. So most ProCare Health vitamins have B12 in them, and honestly, it has enough if you don't want to have to take an additional B12. But some people feel like it gives them extra energy. Also, some people have B12 deficiencies. Some people don't absorb B12 as well orally through a tablet, a chewable, or a capsule. And so there's other forms available like a sublingual, liquid drops, a mouth spray. And that's why getting your blood work checked periodically is super important to know if, something like this is enough or if you need to add B12. Some programs just recommend to go ahead and take it. So if you decide to go ahead and take extra B12, here is the amounts recommended. You can look at the bottles to see what amount is in them as well. I'm looking here. See if I can do it and look and see because I have one contact that's close up and one far away. I'm looking for our B12 amount. It is actually 1,000 milligrams. So, and that's daily as opposed to, ejection a month. If you were taking it orally, 350 a day of an oral tablet is good. So we have 200% there. Put that over there. And then we're going to go on next to calcium with vitamin D3. So there's not many multivitamins out there that actually have the calcium combined with the multivitamin. Usually I'd say about 90% of the time, you have to take those two separately. And so if you're taking them separately, it's recommended two things. Number one, that you split them into dosage, maybe 3 times a day. Like most calcium supplements come in 500 milligrams. They also are usually formulated with 500 IU of vitamin D3. Most of them go hand in hand because they help one another absorb better. And so splitting them into 500 milligram or 600 milligram dosages and taking them 2 hours. So we're kind of in this little part down, about the third or fourth bullet point, split into 500 to 600 milligram dosages, being mindful of serving size and spacing doses throughout the day. The other thing is there's several different forms of calcium. This is the second bullet point here. Research shows calcium citrate and TrueCal are well absorbed. Both are less dependent on stomach acid for absorption. So below that it says less absorbed form, calcium carbonate taken with meals. What I will say is that calcium carbonate is a little less expensive than say calcium citrate. If you're buying it over the counter, it's a lot easier to find. Like if you're going to Walmart or Walgreens or all of those places, I'd say if it's your decision factor, like if you're thinking, I can't afford calcium, that type of thing, then by all means, it is a little less expensive. It's what you can find in like Tums, and just a lot of the over the counter, like I said, at the supermarkets and things. Bariatric vitamins, they're calcium formulations. You're going to see a lot of them with citrate. Now, ProCare Health independently uses something called TrueCal, which is an amazing product. It is actually derived from the actual bone minerals, and you get all of it's basically broken down where you get all of the minerals from bone plus the calcium, and it's absorbed really well. So it has a really smooth taste, and
It's not gritty. It's not gritty.
You are right, Brittany. Yes. What would you say is your favorite part about it?
It is derived from milk, but it has the same minerals as bones. It has the same mineral composition as your bones do. So it's the closest thing that you're going to get that isn't actual calcium, I guess. I don't know if I'm explaining that right.
Yeah.
But
yeah.
you know what? I like you guys so much. I'm going to put a link in here that describes it better than Brennan and I ever could. There is a video on here, and I think it's like 3 minutes long, if that, and it's a cute little animated video. Go and watch it because it's just as good as calcium citrate, only, I mean, I don't want to say it's better, but but it's just as good, if not better. But there is a link. I just posted it. It's the Glanbia nutritionals.com. So after this, I would encourage you to go and watch that video. It explains it very, very well, and that is the type of calcium that ProCare uses in their calcium chews.
Yeah. So find something that you like. Like I would say, try different things. A lot of these vitamin companies, including ProCare, have where you can get on their site, and we'll show you that later, how to get on there and request free vitamins, samples. You can request vitamin samples from almost any company. There's a few of them that do charge. ProCare doesn't charge, but there are a few that charges, but it's so worth it. And start with something. Like if you're just at the beginning of your journey, don't let it scare you. Start somewhere. You can, I'd say, if you don't like your vitamins, change it up. There's so many different kinds out there. I promise you can find something you like that works for you.
And Marlene did have a really nice comment. I wanted to just point that out. It says, even though it is derived, and she's talking about TrueCal, for those who may not know, even though it is derived from milk, I find your product does not cause my normal reaction to American cow milk products. It is super. And I feel like that's because there's not, I want to say they take the sugars out of it, which is the same thing as lactose. So Brenda, keep going. I'm gonna do a little bit of research.
And Erin, she's still on the call. She's one of our colleagues. She's super smart on all this stuff. So she might be able to help us.
Yes.
I want to
But that might be why you don't get a reaction as opposed to cow's milk.
Well, I do know that Nick, who's our company, one of the owners of the company, has said before that he has some lactose intolerance issues, and he's tried taking quite a few of them at a time just to see if he had any issues, and he's never had any issues. And
he
honestly,
would.
he's the guinea pig for everything. And honestly, I do myself sometimes have a lactose intolerance issues after having weight loss surgery, and I've not ever had an intolerance to this product. So anyways, but regardless, try something, find something that you like and that works for you. And then if you're a bypass sleeve or lap band, the recommendations are actually different than a biliary diversion or duodenal switch or SATI. You're going to be taking 500 milligrams, anywhere from 300 to 500 milligrams more. So, look at these amounts, compare, 3 chewables here with the bypass sleeve and lap band if you're taking 500 milligrams. over here, 4. If you're taking 600 milligrams, 2 here, 3 here. So just be aware of that. There's lots more of extra stuff to read on the side notes, guys. So please always feel free to come back and access these handouts. And also I want to mention on the comments on all of these, some programs will recommend you start taking your vitamins before surgery, some after surgery. I do know most programs do look at your vitamin levels right before. A lot of times it's assigned in with your preoperative labs, like when you're coming in and having all of your stuff done right before surgery. You know, when you come in and talk to anesthesia, you come in and talk to pre-op. A lot of times that's when a lot of programs will draw your blood. And seriously, there is probably about 10 to 15 different labs being measured by most programs. And so a CPC, a profile, a ProTime, vitamin level labs, you're looking at usually magnesium, calcium, B12, all your B12, B6, B1, zinc, copper. It depends on your program, but usually they measure a ton of different things and look at all of those to get a baseline, to see where you're at, before you have your surgery, to see if you're going to maybe need extra supplementation. And then usually, I know the program I work for, we did post-op labs at 3 months, 6 months, 1 year, and then we did them every year thereafter unless somebody needed more frequently. Some programs may monitor them at 6 months, 1 year. Some may just monitor them yearly. Some may do it more frequently. And if your labs are off, they may even monitor you more quickly than that. So my whole point in that is just that post-op labs are important. In fact, I have all of my labs printed, and I'm getting ready to have all of mine drawn. They're important just to kind of keep a check to make sure that nothing's off, because your absorption of your stomach is different than a normal person. So just be aware of that.
I have a quick question.
Sure.
So, I don't know, you might have already said this, but how many years are you post-op and you're still getting blood work done? Just so people know how important it is.
Oh, thank you. I don't know who asked that question, but great question. So it is usually recommended, annually, once a year, regardless of how far out you are from surgery. My surgery was in 2013. So it is usually generally recommended once a year, unless your labs are abnormal and you need it more often than that. But typically for most people.
Okay.
Any other questions?
No, that was actually a question I just had, but I wanted you to share with people, even though you're so far post-op, you still need to get them done. Marlene did comment, so I'm going to share that. And I don't know if it's Suzanne or Susan, but she did say hi, so I'm going to say hi.
Oh, hi.
Marlene said, I urge other patients to not find reasons to avoid the testing. It is so important for your medical team to know how you are doing. I used career as an excuse. Big mistake.
Yeah, it's easy to get distracted, and expense. Let me tell you, important things. You need to make sure, for one thing, call your insurance. See if your insurance covers. I did. I made sure that my new insurance covered getting labs done because I was concerned, because at one point it cost me over $700 or close to, I don't even been more than that, to get labs done, and it scared me. I was like, oh, that's so much. But if you use the correct diagnosis codes, if your insurance covers, your bariatric program can help you with a lot of these things. If you decide to go to a primary care and you're not following up with your bariatric surgeon for whatever reason, maybe your insurance doesn't cover, or you just would prefer not having, if you're already seeing your primary care once a year for other reasons and you're just wanting to not have those specialty charges, because sometimes insurance covers, sometimes they don't. Make sure that your primary care doctor knows what tests are usually required. You can check with your surgeon. And also, like I said, those diagnosis codes, because those will help cover it. Maybe they can use different languages. Sometimes, diagnoses make a difference. If your insurance doesn't cover post-bariatric surgery care, maybe they can say, you're coming in for a blood pressure check or whatever. There's ways to get around things to try to make it more manageable. And I know I've used LabCorp before, depending on what's in network or out of network for your insurance coverage can make a difference. With LabCorp, I think the last time I had mine, it literally only cost me like $110. So it was very, very doable. So anyways, we're going to go on to iron. So iron may or may not be included in your multivitamin. Some people choose to take their iron separately. There's different forms of iron, and I'm going to kind of talk about that a little bit more here in a little bit. But what I would say is if you can tolerate it in the multivitamin, it's easier. But if you have kind of an intolerance to iron, maybe it upsets your stomach or it causes nausea, there are other forms like a liquid. There are more easily digested forms. So it depends on you. At least 18 milligrams per day is usually required over the board. Now, if you're a female and you still have menstrual periods, or you're at risk for anemia, like you've had blood work done before and it shows that you've had issues with anemia, then you may want to increase that dose anywhere from 45 to 60 milligrams. And one other thing here, I haven't really been saying much about the comments on either of these sides, on the regimen side or the comment side, because that's something you can go back and refer to. But again, if you're starting your multivitamins before surgery, it may affect your pre-op labs. So just be aware of that. It may make them a little higher. If you're starting them after, most people can start them day one, right after while you're in the hospital. If you don't want to have to bring your vitamins to the hospital, you could start them when you get home. I would say start them as soon as you can. Mm-hmm. Another consideration, I know our surgeons used to tell people, if you're severely nauseated for whatever reason after surgery, or you're having a really hard time tolerating foods and liquids, you may even want to wait maybe a week or two. Now, your bariatric surgery program will probably have some opinion on this as well, which they can help recommend as well. But sometimes bariatric surgery vitamins can be a little hard on your stomach. So just be aware that make sure you're able to tolerate them and it's not affecting your oral intake and that type of thing. And if it is, talk to your program, that type of thing. So kind of go down here to fat soluble vitamins. And I know this screen may be kind of small. I just want to mention on the phone here, we have an app. You probably can't see it, but on my phone I have it downloaded. It's the Crowdcast app, which if you guys are watching, you're watching on Crowdcast. And you can download that, and all these events are live on here. So if you're watching on your phone, all of this is going to be super small. So I apologize, but it is a good way to watch it if you're on the go. A lot of people are nowadays.
Mm-hmm. Hey, before you go on, I'm sorry.
Yeah.
There's just a few comments I wanted to share with everybody in case I don't know on the phone if maybe they can see the chat or not. So that's why I want to say these.
Okay.
So we were talking about labs earlier, and you were talking about checking with your insurance. So Janine had a really good point. She said, if you choose to have primary care physician order your labs, make sure that you ask your bariatric surgeon or program for a list of the labs, because it's going to be different labs. That's a very good point.
Absolutely, 100%.
They're gonna look at different things.
Thank you, Janine.
For different levels.
In the primary care, it's kind of like you go to a beautician because they specialize in hair. You go to a heart doctor because they specialize in your heart. You go to a lung doctor because they specialize in lungs. Bariatric surgeon doctors know what to look for as far as vitamins. So your primary care, that may not be quite their focus. So yes, thanks, Janine. That's a great suggestion. Okay, the next thing we're going to talk about is fat-soluble vitamins. This is another difference between a person who's had the bypass sleeve or the lap band. That second column there is going to be different from that third column, which is the bilipancreatic diversion, the SATI, the duodenal switch. So recommendations are a little different. For a person who's had the sleeve and bypass, especially lap band patients, their recommendations for vitamins typically are multivitamin and some of these things here. I will say there is no real issues anatomically with absorption after the surgery as opposed to before the surgery. So whatever a normal person would normally be able to take. Now, your food and consumption is going to be possibly different. So, additional vitamins may be helpful for that reason, but absorption reasons, not so much. So the second column here, which talks about vitamin A, D, E, and K, those are going to be normally found in a regular bariatric multivitamins. Most of your bariatric multivitamins, you'll find if they're a reliable multivitamin, typically they follow these guidelines that I'm talking about by the ASMBS. So as the ASMBS changes their guidelines, they changed 3 times within the time I was a coordinator from 2012 through 2020. And those vitamin companies typically will follow these guidelines, and they'll, change their vitamins to make sure that you're getting what you need. So if you're taking a bariatric vitamin, that's another great reason to take a bariatric multivitamin, because they follow those guidelines and will tweak their vitamins. If you're a sleeve bypass or lap band patient and you're taking a regular multivitamin, most of these A, D, E, and K will be in there. Now, if you're a SADI, a duodenal switch, DS patient, then you may need a little bit more of vitamin A, okay? Vitamin K, those 2 things. Vitamin A, ProCare Health, theirs will get you covered on the vitamin A. You'll have enough. Vitamin K, this formulation has 150 milligrams of vitamin K. Additional vitamin K may be recommended by your bariatric surgeon provider. Vitamin K is something you can buy over the counter. Sometimes physicians will prescribe it with a prescription. Sometimes it's covered by insurance, sometimes it may not. It's pretty inexpensive, though, from what I understand. And I know, Janine, if you're still on the call, if you want to put anything in the chat box about she has had a duodenal switch, I hope it's okay I share that. She's typically very open with her story. And so she's even came on and did an interview with us about it. So if there's anything extra you want to share there, please feel free in the chat box. Or if anybody else who's had one of those surgeries wants to say anything about that.
I also wanted to throw out there real quick, because I don't know if everyone here knows that, but since we are talking about, you're referring to the ProCare Health vitamins, and you were talking about a reputable vitamin company, ProCare Health is the only vitamin company on the market that actually tests each of their lots that they get in. So you are guaranteed that what's in the bottle matches what's on the label. So I wanted to say that because no other company does that.
It's pretty amazing. And usually during these lives, I'll just be honest, we usually don't even talk about our sponsor that much.
Not really, no.
We
but
do
it's
at
so
the
great.
end. It is, but today it just, for like comparison reasons and being able to kind of share different things with you, it just comes naturally for us. And so whatever you take, please just check these things just to make sure you're getting what you need, because it is important. And thanks, Brittany, for bringing that up. So
make sure it's a reputable company too.
100%.
Hey, we do have a quick question in the chat though. Gloria wants to know, isn't prenatal vitamins similar to bariatric vitamins? That's a question for you, Brenda.
Well, and I would say it kind of depends on the prenatal vitamin. I do know I've heard of some bariatric programs telling their patients to take prenatals. What I would do is so that I don't tell you wrong, take after this, pull this form up here that I have pulled up. And basically what I'd like for you to do is just take the prenatal vitamin. You can actually, most prenatal vitamins, if there's something that are fairly common, you can actually pull them up online and look at the back of the label online if you don't have it. But if you have the bottle, you can compare it to what's on here and kind of see. Prenatal vitamins are typically formulated just a little different. They have several different differences. I have a slide at the very end of our presentation. If we have time, I can show you how our ProCare Health does make a bariatric prenatal formulation, how that's different. But in general, I'm not that familiar with some products, that are out there. So kind of remind me when we get to the end, and hopefully we'll have time to kind of share a little bit about our formulation. but I can't really say about other formulations. You probably just have to compare it um, mineral by mineral, vitamin by vitamin.
And I will say that our prenatal formula does have a lower vitamin A. And I'm sure that's probably because for the baby, I would imagine. Um, but yeah, like Brenda said, just compare label to label.
Yeah, absolutely.
Um, Janine said that because you were talking about her duodenal switch, she says I needed more ADEK as a duodenal switch patient than any ADEK multi on the market provides. So she preferred to take those separately, those four.
Mm-hmm.
Um, and she was like, Brenda, I was already typing that as you started to speak. So yes, she's comfortable sharing. And actually, so Erin jumped in and she said prenatals have less vitamin A because of the possible side effects to the baby in utero. That's what I was thinking. If the reason why there's a lower, it's probably because there's a chance it could harm the baby. If it was higher, I'm saying. So that is something that you will probably need to take more of if taking a prenatal instead. So what Erin's saying is if you're just taking a prenatal instead of bariatric, then you probably will have to take another form of A. But like Brenda stated, you have to look and add it up. So just make sure that it's adding up to this chart or what your bariatric program is recommending to you.
Yeah, absolutely. I mean, I know whenever I worked in our coordinator role, people would bring in bottles all the time. Sometimes they'd have like 10 different bottles. And it was like, honestly, it is so much easier. And I'm not just saying this because I work for a bariatric vitamin company. It's so much easier taking a bariatric vitamin because what happens is if you take something over the counter, you may have to take 5 or 6 different things to equal what's in a bariatric vitamin. You may be taking
So
so like you
that
may be
might
taking extra
be
iron, you may be taking extra B12, you may be taking extra um, B1. I mean, I'm just kind of I'm just saying if you take a regular multivitamin over the counter, kind of just compare it to this to the list.
And that might be what Marlene is talking about too. She just commented a minute ago and says, please talk a bit about how some people may need customization.
Oh
So
yeah,
she said, I did
100%.
my own research after seeing problems. This is how I found ProCare and use your product to create my solutions because my care team did not resolve the issues. I needed more B, magnesium, calcium, iron, and C, but only ProCare had iron supplement that she could take. Um, and then Aaron really quickly said, ProCare's prenatal gives you more of what you need while still keeping things safe for the baby. It also has extra iron in it too.
Yeah. Most definitely. I mean, uh, it's just there's just so much information out there, and honestly, sometimes this I will say our like surgeons, their main focus is surgery. They love to do surgery. That's what they went to school for. That's what they love. Um, you're probably going to be relying on not only them, but your dietitians and your nurses to help you with tweaking some of these things. But the doctors, you have to rely on them to help guide your care. So it's a service where bringing a lot of different disciplines together. Now, I shouldn't just generalize. There may be a lot of, it may have just been my own experience. I would just say that, um, that make sure that if you are not getting the answers that you need, that you reach out to other people and find other people to
Mm-hmm.
help you. So,
Yeah.
um, and I'm just going to kind of skim over this real quickly. Pre-surgery, I mentioned already, baseline labs are helpful. After surgery, vitamins are recommended lifelong for post-bariatric surgery patients. So regardless of how far out you are, still taking them is recommended. Ongoing vitamin lab levels are preferred. And I already talked about how often, depends on your program. Many multivitamins contain biotin, is helpful for hair strengthening and decreasing risk of hair breakage. That was always a huge question that our patients had. What I will say about biotin, sometimes people will take 5,000, 10,000 milligrams of biotin. Our dietitians researched it a little bit, and they from my previous program, not our ProCare team, but they found that it didn't seem to be harmful to take too much biotin. If there's a dietitian on this call that has maybe some other opinion on that, please feel free to comment. But basically, sometimes people are concerned about that after surgery, hair breakage. Anesthesia can affect the way that your hair follicle process the hair and it grows. Stress, you're going through a tremendous change in your body, and that's stress. And that can change your hair. Honestly, for a lot of patients, it's temporary. I found for probably about 75 to 80% of people who had surgery, and that's just a number I'm throwing out there through my own experience. Other people's experiences may be different, but a lot of times it's temporary. You may lose starting about 3 to 6 months is when a lot of post-op is usually when people experience that because of the way the hair grows and the follicles and all of that. That's when a lot of times people will notice that hair starts falling out or they're losing hair. And by about a year is typically they'll start seeing regrowth. I know for myself, I had all these little bitty pieces sticking out everywhere because I had lost so much hair. And I mean, you guys probably can't tell because I have my hair in a little sloppy bun, but I mean, I have a lot of hair. So it does, for me, it did grow back, and hopefully I can give you guys some a little faith that not everybody has that issue. And then we talked about the pregnancy a while ago and screenings. People who become pregnant, it's definitely recommended that you follow your blood work pretty closely and maybe even talk to a dietitian, that type of thing. I'm not going to go into that. We do have an actual program on that as well, talking about pregnancy and all of that. We did an interview with one of our gals. Her name was Lauren, and she kind of told her story, and we talked about bariatric vitamins with pregnancy. So that is on our ProCare channel, which we'll share. I think Brittany's been sharing. I don't know if you shared our channel yet, but
I shared the one specifically with Katie about the new nutrition labels, but we're gonna show you guys. We're gonna share our screen and show you guys so you know what we're talking about and you know where to find them. But real quick, there were a couple more comments I wanted to share. Amy said, "Thank you so much for these high quality vitamins and calcium. I love them. I'm hoping you do more flavors for the calcium chews." Amy, you're so welcome. We're happy you love them. We really, really are so happy you love them. And to be honest with you, I hope they come out with more flavors too. My favorite is the cinnamon roll.
My favorite is the sea salted caramel. Anybody else can comment with their. We have chocolate too. That's going to be going out of stock. We have that goes maybe by the end of the month. So if you guys are interested, we have a little special discount code for that too. And it's through the 16th through tomorrow.
Michael, he's been on all of these, hasn't he?
Hi, Michael. Michael's a coordinator too.
Oh, okay. I think I remember you saying that. Yeah.
I just love that you join us, Michael.
I know, me too. I love that we're getting to know people too.
I know.
He said this is a topic that can be pretty complex and confusing even for the pros. That's the beauty of taking a bariatric specialty product. If someone tells me they are taking ProCare 45, so he's talking about our special 45 formula, I know immediately they are getting everything required except calcium. It's much easier than doing this vitamin by vitamin on your own, and I would agree. Who has time to take that many vitamins in a day?
And Suzanne asked, do they taste okay? Get a free sample.
Yeah, we'll show you how to do a free sample too towards the end. Oh, Erin, I didn't know if that was a secret or not. She goes, there are some new flavors in the works.
I know, you don't know for sure.
We also have something else coming out too. I don't want to ruin it, but you're all gonna love it.
Some really good things.
Janine said my favorite calcium is the original sea salted. That's Brenda's. Do you want to read a couple, Brenda?
I can. It says Marlene lemon or raspberry calcium chews. I guess she's saying that would be her favorite.
Okay.
Michael said these groups are great. Thank you, Michael. That's so sweet.
Yes, thank you.
Gloria says vanilla. Suzanne said these flavors are for the bariatric multivitamin. Janine, the flavors are the calcium. There's a
Yeah,
little clap.
we're talking about the calcium chews. But we can show you some of the flavors we have of the vitamins too.
And Suzanne says, I know in 2017 the capsules were yucky. So I don't know. I don't know. I've kind of tried them with, I guess I've tried their, I guess it's all about what works for you. So
Yeah, everybody's different.
yeah, definitely. Um, try chewable maybe. I don't know if she's tried that. Um, so I'm going to go back to our presentation just to kind of keep us on track. And I may have to kind of speed things up quite a bit just because we're at 5:51 and depending, we can go 6, we can go to 6:30, you know, and if you guys can't stay with us, depending on, you know, your schedules and that type of thing, if you ever have to jump off, just jump off and you can always come back and listen to the replay. What I'm going to do is go quickly back to the handouts and I'm going to just show you guys a couple more things and then we'll come back and we'll go to questions and answers. Okay. So I
Hmm.
have actually quite a bit more, but we may just have to kind of like synthesize it just a little bit. But I will show you, we have handouts, so you can always refer back to those. So let me share my screen one more time here. We're going to go to my PowerPoint. So I'm going to kind of see here, I'm kind of having a reach over. So compare to your program, what does your program recommend? Just going back to that. We talked about this, you know, basically the benefits, increased energy, maybe improvements in your hair, skin, and nails, your lab values, and what you avoid: anemias, osteoporosis, heart problems, basically every muscle, every organ has exchange of these vitamins and minerals. And so what happens is when your vitamins are low, it affects you on a cellular level. So just knowing that. And then I have another one, a handout on risk and deficiencies. And I'm going to just show you that just super quick. I'm not going to go through it real thoroughly, but I will show you what it looks like. So can you see that, Brittany? I'm going to have to.
Yeah, that's good.
Okay. So risk and
And
deficiencies.
we did have a couple people join us on the call, so I'm going to go ahead and repost the handouts just in case. So,
Absolutely. Please do. So risk and deficiencies, you guys have this little handout all the way from vitamin D, copper, zinc, vitamin A, folic acid, B1, B12. Go back, review it if you might be concerned about a deficiency and look and see what we got there. I'm going to stop sharing that because I'm not going to take a whole lot of time just because I want to be good with you guys this time. I'm also going to kind of talk, if you're struggling with nausea, I do want to hit that because that's sometimes a huge barrier for people. So a couple things. And I'm going to increase the size just a tiny bit there. So iron can cause an upset stomach, and a chewable or liquid form may be more easily absorbed. And our dietitian, Katie, actually reviewed my whole presentation before I kind of went on, and she suggested this next little bullet point: if iron continues to bother your stomach, try a multivitamin with less iron or no iron, and then add iron in another form. So most forms of iron that are seen or available focus on either ferrous sulfate or ferrous gluconate. You may want to write those down if you're listening and you're struggling with the iron. So, or either ferrous sulfate or ferrous gluconate. Both are pretty constipating. Ferrous fumarate, I hope I'm pronouncing that right, is a non-constipating form and used in ProCare vitamins. There's also a pre-broken down type you can find called carbonyl iron or chelated iron. So again, these are not in the handouts that you're receiving. So if you're interested in that information, write that down. If you're taking a capsule or pill, take it with food. Sometimes that can help adding a little extra something in your stomach so that when those enzymes are breaking down the food, it's not irritating the lining in your stomach. And then also you can take vitamins at nighttime before bed so that you sleep through that period that you would have previously experienced nausea. Now, I will say, somebody was talking about the bariatric ProCare, the capsules, and I can't speak for other capsules, but I'm going to kind of show you what this one looks like. It has a clear-coated gel coating on the outside. And basically you can actually turn this, and I'm not going to do it because I'm going to make a huge mess, but you can actually put that in right after surgery. I found like if you're not tolerating a chewable for whatever reason, you can actually break these open and you can add them to like yogurt or cottage cheese or jello or applesauce, depending on what you add to, because they do have some flavor in it. And so may want to have something that kind of masks the flavor a little bit, but you can't actually break open the capsule if you're not tolerating the gel cap for whatever reason, and you want to just break it open or you don't want to have to swallow it. You can break it open and add it into food. And some other products may be like that. I'm just not that familiar with any other products that use a gel cap, but that is another hint to use. And I'm going to kind of also just mention, I have the biggest barriers that people find is your budget. You have to find something that fits your budget. Also, ease of taking that fits your lifestyle. You want something that's easy, like a 1-a-day multivitamin, or maybe it's a twice-a-day multivitamin, because you're also going to be taking it with calcium and vitamin D. And if you're separating those out and you're having to space them apart so that you get the best absorption, making sure that you do that. What I recommend is finding a container so that you can line out your vitamins, or setting them out. What I do is I have my vitamins kind of together in a reminder place so that I see them. And then I take them out and I set them on my desk. And so I know what I need to take for the day, and then I space them out accordingly, according to my day. But whatever works for you. Sometimes there's apps, like Bariatric. They have an app that has a reminder on it that will remind you to take your vitamins. A little reminder will pop up. Some of our patients would set a timer. However you can do it to make it fit your lifestyle and fit what you're currently doing. Taste. Somebody mentioned taste. If you don't tolerate a chewable, try a tablet. If you don't try a tablet, try breaking it open. Try a different formula. Try a different company if something isn't working for you. Try something that works for you. And then the quality of the product. We talked about this earlier. Helps you stay healthy and have good lab results. It's super important to make sure the quality is there. So those are all important things. And I have a little journaling exercise, so I'm going to stop sharing my screen here. Brittany, can you still see the screen? Brittany, I think, oh, your mic, you were on mute. Now you're off. I took you off.
Oh.
I was just talking away. I hope you guys could see my screen okay.
I couldn't see it. I thought you stopped sharing it.
Oh, gotcha. Sorry about that, guys. But you can hear me,
it's
I
okay.
guess.
Well, and I resent all the handouts too.
Okay.
So,
so basically, that last one, I was just basically on our PowerPoint and basically just talking about the vitamins. I do have one thing I am going to share here, though, is I'm going to share this last handout, and just for a second, and we're going to go there.
Okay.
Okay.
I do see it.
It's called Journaling Exercise Vitamin Recommendations, and I'm going to, so like, write down, choose a multivitamin, choose your iron, write down what you want, write down the cost, any other supplements that have been recommended to you, make a plan, and then go out and figure out what you want to buy. So those are the starting points. And I kind of, when you pull up this handout, you will have, I made one with, made an example for a sleeve or bypass patient. And I did use ProCare products because that's the most familiar, but you can use anything. Knowing how much you're going to be paying is super helpful. So I made one for ProCare. These are choosing one brand, not both of these. You wouldn't have to take, a multivitamin plus a probiotic, for example. But choose one out of this category. Choose one brand out of the calcium. And it kind of give you an idea of what ProCare offers, but you can do research, go out and research other companies and see what they have. And that's for the sleeve and bypass. Now for a BPD or SAD patient, here's some different recommendations. Choose one. And here on vitamin K, some recommendations as well. So Again, listen to what your program tells you. I don't want to compete with any other programs or anything. And then find your own plan down here. So this is just a journaling exercise. If you choose to use it afterwards, welcome to do that. I'm going to stop sharing that. Come back to you guys. Sorry, it takes me a second. Okay. Any questions before we start Q&A and kind of talk about some gifts for them?
We have 3 questions sitting in the queue, but I mean that's for Q&A, right? That's what you mean?
Yeah.
Okay.
What do you think? You think we should go ahead and do Q&A before we talk about any kind of product stuff? You want to do that first?
Yeah, let's go ahead and do the questions just so we make sure we have some time and we're not rushing it, you know?
Okay, perfect. Now, Brittany, what I'm going to do is I have them probably listed with you. I'm going to press start answering, and then I'm gonna allow you to ask the question to me.
Okay, that
Okay.
sounds good. So the first one is ask me to speak briefly about my experience after my surgery in Miami. The implications of improper management of supplementation and the vitamin regimen is so important that I would be happy to speak briefly on my own experience. So that's actually Marlene. Marlene, if you would love to be on screen, we would love to hear from you.
Yeah, let me go back and I can invite her on screen.
And once again, if you are not comfortable, you can hit decline. But if you are comfortable, then you will hit accept. Ooh.
Sorry, it's taking me a second. Okay, I just invited her on screen. Okay, she may be joining us here. Give her a second. Well, you know what? Hopefully she's coming. Let's try. Let me re-invite one more time. Oh, here she is.
There you go. Hey,
Yay!
good to meet you. Good to see
Hi!
you. Hi, Janine. You know, it's been 16 years since my surgery. I fell through the woodwork because the doctor lost his nutritionist after my first follow-up week, which was approximately the end of my 4th week. As a result, he didn't have a nutritionist, and I was trying to follow paper written instructions, no feedback, avoiding testing because I was working and traveling around the state. And I fell into some major problems. I became very deficient and didn't know it. The doctor's team couldn't keep up with the problems that came out of losing their nutritionist. By April of 2006, 5 months after surgery, I started developing some terrible things along with a young Brazilian girl who had had the surgery with me. We both developed giddiness, severe giddiness. We developed headaches, tinnitus. She worked in my local credit union. We talked about this. We were having the symptoms at the same time. I tried for years to fix the problems. I eventually got around to regular testing. I tried many, many sources to find out what my deficiencies were. I worked with several nutritionists. And I have to tell you that 5 years ago, when I found ProCare, major, major changes in my health. I got to a stage where I wasn't walking well. I couldn't walk in a straight line. They were all to do with deficiencies. I had to have physical therapy. I do now walk in a straight line. I cheat a little bit, but I don't mess up on my nutrition. If I forget my pills or something comes up, like when my father got sick, you will see the difference in my health within a matter of days. So that's why I'm urging everyone to get your testing done regularly. Don't fall into the pit that I fell into. Keep in mind, I had my surgery a little later than most people would. I had my surgery in my early 50s, but I still strongly urge that people not make excuses like I did, not I had the bad luck of falling through the woodwork because of timing, but really take care of yourself, make that plan, as she said, about what you need, and find the money for it, because believe me, it'll be the most important thing that you do. You see the white hair? I got that from missing pills.
I was actually going to tell you, you look fantastic.
Yeah.
Hey, late 60s, that's because ProCare got me up and moving. And I am incredibly grateful to you guys. Incredibly grateful. Thank you so much.
You're so welcome. I'm
That
so
is
happy we invited her on
wonderful. I
screen. That makes
know.
me so happy.
I love having people like that on screen.
I
Having you on
know.
screen because honestly, your story just tells it all. I mean, you can. What can I? Do you mind me asking which vitamins were you most deficient in?
I had a lot of things that went wrong in a fairly short period of time. Severe iron deficiency, but unable to take the majority of iron pills and liquids that were out there. Tremendous stomach upset, and constipation and other problems. I had problems with vitamin K, magnesium, vitamin C, vitamin B, and they tried different regimens to improve them over the years, and we couldn't get an improvement. We really couldn't, because I had problems taking multiple sets of pills during the day. There were just so many. So finding a solution where the pill was one a day, wonderful. I do take an occasional vitamin B towards the end of the day, but B12, in fact. But I generally am able to say that the core of my program is the one a day with 45 milligrams of iron. They had recommended 50, but I eat a lot of meat to make up my iron intake. And my life has just changed so much since finding a reliable source. And I trust you because I know you test the products. You didn't even need to tell me. There were other suppliers and there were problems with some of the suppliers. So it's having a reliable American company that meets standards that I trust was important.
Such a wonderful testimonial. I love your accent too. I gotta say. I don't know. It may not even be an accent, but I just your voice.
English, Harry, William, the rest of them, been here a long time. But it modified because I worked in the corporate world and I was down on Wall Street. But I love this country and I love what is available to us to make ourselves the best we can be in terms of our health.
So I have a question. How did you come across ProCare Health?
Tremendous amount of research. I just kept looking. And I
Really?
read websites and I read the information they provided and I read the labels on everything to see if it met what they told me to do. Because I was very surprised to find that quite a few doctors did not seem to know what was needed. So I went out there and I did research. I ran across ProCare. Your website was highly informative, and I took the first chance and I've never gone back.
Well, thank you so much for sharing. And there's a lot of
Yes.
other people in the chat box. You'll have to go after you're off screen. You'll have to look at that. There's lots of people thanking you for sharing. Thank you
You're
so much.
welcome. You're
So we
welcome.
really appreciate it. So you're gonna find that you're gonna be going off, but I want to thank you and I appreciate you so much for doing that.
And thank you so much for being here too.
Thank you. And thanks to Janine and some of the others for their suggestions. I can always learn something new. Thank you very much.
Yeah. Thank you, Marlene. Okay. So we're going to go on to the next question. Okay. I'm pressed the start answering.
We kind of already touched on this. I understand that prenatal vitamins is similar to bariatric vitamins. Is that correct?
Let me share my screen real quick here. And I'm going to go into the PowerPoint down here to the prenatal.
I can see it, by the way, too.
Okay. So how it's different on our, this is just ProCare. This is not every vitamin company. And they're the only one that I'm aware of that makes a prenatal formula for people that get pregnant after weight loss surgery. So this is a bariatric formula for prenatals. But it has 60 milligrams of iron, okay, instead of the normal 18 or 45. It has the reduced vitamin A that we talked about. It has 1,000 micrograms of folic acid, which promotes brain health and spinal development. It has extra potassium to help with muscle cramps, fatigue, and weakness. Vitamin B complex, which provides natural energy and stress support. And it also has a gentle prenatal blend, which I think is so cool, of kind of some superfood of, and I'm not going to be able to say this, spirulina, as well as red raspberry, dandelion root, and ginger to enhance digestion. So that is just simply ProCare formula. Again, you may have to research with other formulas. So I'm going to go down to the next question, and I'm going to press start answering.
Okay. Without going over medical, I am dealing with a blood disorder that is genetic, that is exacerbated by absorption issues. But I get B12 shots monthly, and my ferritin dropped from 62 3 months ago to 28 last check. So if I can find a supplement that helps, question mark.
Okay, I'm rereading this.
I would say it might be easier for you to read it, sorry.
No, you're good. So I'm wondering if Anis, I'm not sure if I'm pronouncing that right. How would you pronounce that?
I would pronounce it anise.
Anise, okay.
Anise?
So I'm wondering, it says I get B12 shots and my ferritin dropped. So I'm not sure she's relating that the B12 is related to the ferritin. I don't think it would be. I would say probably it's two separate things, but let us know in the chat box if that's not the case. What I would say with ferritin levels, with iron levels. So if oral iron supplements, if you're taking, 45 or 60 milligrams or additional iron orally that's recommended by your doctor, could be your primary care, it could be a specialist, bariatric surgeon, or it could be another specialist, that's helping you there. If that's not working, you may need infusions. There are iron infusions that can help you. They may need to do special testing before going that far. I know one of my colleagues, one of the symptoms of having a low iron level is chewing on ice. Like, she would chew on ice all day long, and she ended up having to have infusions. So maybe just check into that, talk to your doctor. It may not be your bariatric surgeon that gives those. It may be another specialist, hematologist, okay? So I'm going to kind of move on. Also, I'm going to go to the very next one, Brittany, and I'm going to press start answering.
Okay. When is the best time to take your one-a-day chewable, morning or evening?
So I guess it depends on you. I a lot of times do take mine in the morning, but I take them with food just because I do sometimes get a little stomach upset. If there's not really a set time that you would have to, if you take, sometimes I mentioned in the presentation that sometimes people take them at night, right before bedtime, because if you fall asleep, you don't necessarily notice any kind of nausea. If you're not having nausea or any kind of issues related to that, it may not be an issue. Now, we did today, Brittany and I did a live presentation on magnesium. Now, magnesium is not even listed on the recommendations for that from the ASMBS, but it's in the vitamins, the ProCare vitamins. We actually have the highest amount possible in our chewables and our prenatal and our probiotic formulas. Our capsule formula these all have 200 milligrams in them daily, higher than, I don't want to say for sure, but I believe higher than any other company out there, bariatric formulation.
For the once daily formula, it is the
200
highest.
milligrams in the chewables, and the probiotic and the prenatal. Or was it the prenatal had it too? And then the multivitamin capsule one a day has 100, so it still has a lot, but it just doesn't have as much as some of these other formulations here. But those are higher than most on the market out there. And taking magnesium at nighttime has a special benefit because it can help you sleep better. helps the sleep pattern. So just to kind of put that out there as well. So that's all that's listed on the question and answers. We're gonna try to go through maybe even a few more if there's some listed in the chat box. But before we stop, we do want to mention a couple other things. Brittany, I'm going to let you take over now. I'd like you to show them the follow on our Crowdcast, and then also anything you want to show on our website, and then we'll go with discount codes.
Okay, yes. So I'm going to try and be quick because we are a little over our time, but let's see here. Chrome tab. This is the one I want. Okay, can you guys see that?
Yes.
Okay. I actually just copied the link. I'm going to post it here in a second. So the link that we're going to post in the chat box is our Crowdcast link. If you aren't familiar with what Crowdcast is, it's just a platform that we use to do these support groups and our live events. So I'm already a follower. If you're not already following us, this box here that says following that I'm circling around will be blue, I believe, and it will say follow. So once you click that, you will get notifications on upcoming events, and you'll actually get a notification right when an event is about to start as well. And like we were saying earlier, there's replays that are available too. So it says on air now. That's the support group that we have here. That's what we're doing now. These are some upcoming events that we have coming up. Healthy food swaps, moving on from toxic relationships, hydration, why it's so important. Some of these are actually from our New Year's resolution segment that we did too. And then these are our past events. So as Brenda was saying, we did a live yesterday on magnesium and why it's so important for you to have it. And also, you guys, we did an interview with Rob, and it was amazing. He's such a great person. Just his outlook on life and surgery is so inspiring. That was really a treat to get to talk to him. So everyone loves air fryer recipes. That's on here. I had a baby after weight loss surgery. I'm not going to go through all of these, but we do have quite a few. I don't know if you guys have ever heard of our Sleeve Life podcast, but we did an interview with those ladies as well, which was very cool. So I think that's it with the Crowdcast, right, Brenda?
Absolutely.
Am I missing anything? Okay.
No.
All right. Next, I'm going to go over to...
You did the following, right? You just did that?
Yeah, I showed him how to do that. Okay, so here, I'll go to our homepage.
I'm reading the comments while you're doing that so that I can catch up on a few of them. I'm sorry if we're not catching every comment because there is so many. I just love when you guys are so active. I love it. I'm trying to catch as many as I can, though.
So this is our website. We'll also make sure we link that in the chat too for anybody who's not familiar with it. But as Brenda was saying, we do have quite a different formula of bariatric multivitamins. So we have the capsule here, which does come in 3 different iron levels for those of you that might not need as much or you do need more. And then we also have the chewables right here too. I hope you can see that. It's kind of... There we go. That's better.
Brittany, what you'll probably have to do is stop sharing your screen and then reshare it so that they can see the ProCare website. Right now, I'm still seeing your the Crowdcast page. Does that make sense?
Yeah. Okay.
Sorry, I didn't catch you sooner.
That's okay.
About that.
So we're gonna post the website like I said before. But if you are interested in looking at any of the products, it's just this drop down link here. We have all of the bariatric multivitamins and all the different formulas here. We have the probiotics and the prenatals that we were talking about, the chewable and the capsule, and then also here are our calcium supplements. And I know we briefly talked about it, but just want to say again, these are like heaven in a bag. And those are going to be actually going out of stock here at the end of the month just because they don't ship very well in the warmer months. They melt, so they will be coming back hopefully in the fall. And then I also wanted to show you guys how to do the free sample because someone had mentioned they had not tried them yet. So you're going to go to the website and you're just going to click free sample. And you're going to fill out all of this information here. And I will say, if you have a particular product that you're wanting to try. Let's say maybe you have a flavor in mind for the calcium chews, or you want to try a capsule over a chewable. Um, any particular flavor, I would put that down here in the message box. And then, yeah, that's pretty much it. Oh, I also did mention that we're the only company that actually tests their vitamins in each lot. If you're curious to see, we also have those test results here too on our website. So you just match your lot number and you would click here and it shows you the lab results. So it's actually really neat.
Yeah, and on top, I want to mention too, so on top of the ProCare vitamins, they have a scanning code that you can, I don't know if you guys can see that you can scan. You just basically use your, I don't know if you guys, they're probably familiar. I'm going to put our discount code, April SG, for 10% off for all of you people listening. We love you. That's until the end, that's through the end of the month. Let me write.
And I also just shared the Crowdcast link too, which is the platform that we use for all the live and sport groups.
I'm putting on here the discount code is till the end of the month. So if you guys have never used these QR codes before, all you do is basically take the camera on your smartphone, see, and you point it at and then there's a little pop-up that comes up and it says open in Safari, and you open it up. So that will tell you about the testing, third-party testing on this specific bottle. So what else, Brittany?
We got one more question.
Okay.
Do you ship to Canada?
So, do you ship to Canada? So we do, and the thing is maybe a little bit more expensive. I'm hoping Erin's on here, unless Brittany you're able to answer. I've heard lots of part conversations on this.
I know that we do ship, but yes, so we do ship. I'm gonna let Erin answer that in the chat about shipping because I do not know and I don't want to misspeak and tell someone the wrong answer.
The simple answer is we do ship. So if you can do your order online, or you can call the ProCare office. The number's on the website. So she's saying sometimes we get dinged with customs, and that's what I was gonna say. If you have questions about that piece, that is a ProCare Health customer service question that Erin or one of our customer service staff at that number can help you at. It's definitely doable, though. Definitely doable. I think that's everything I have. So,
Yeah.
I'm hoping we didn't miss any important question. If anybody has something that's just really they are dying to know or want to know, type it in right now before we log off. Other than that, I think we've hit most things, Brittany. And you guys have the link to the handouts down here if you want to go back later and look at any of those or compare to your vitamin regimen that you're taking. Or if you're not taking one and you're wanting to develop a regimen, you have the journaling exercise. And then if you're questioning whether you might have a deficiency and you want to kind of read up on some of those, that is not an all-inclusive list. Okay, so the risk in vitamin deficiencies is not inclusive. There's likely others out there, but it just kind of give you a little idea. And Erin just wrote, Brittany, you want to read that?
Okay, yeah. Shipping to Canada, oh my gosh, I can't talk. Shipping to Canada can take a while to be received. It also gets expensive quickly when packages are over 2 pounds. So our vitamins are great to send to Canada, but the calcium and proteins, they do weigh more. So that makes it a little bit more expensive. We are looking into expansion into Canada with distributors in Canada.
Thank you, Erin.
Yes, thank you.
Really appreciate your answer. She's in the day-to-day business. Brittany and I both work remotely, I live about 2 hours from ProCare. We go up and travel and go in the office periodically. Brittany's actually helped with shipping some though. She lives a
I
little closer
have.
than I do. You live a little over an hour, maybe an hour and 15 or hour and a half
Yeah, it's about an hour and 15 minutes. It's not that bad, but
away. Um, so I think that's everything. We love you
yeah.
guys. We appreciate you guys. Brittany?
And I do want to say thank you again to Marlene for sharing your story. That was awesome to hear.
We really appreciate that. That brings it home for so many people. I honestly
Yes.
wish we had, and maybe one of these days we'll just do a whole, almost like whole Q&A, because I love having people on screen. It just makes such a difference.
Yeah.
And
Maybe, who knows? Maybe Marlene will let us interview her.
maybe.
Okay.
So, okay. And Kelly Ann says, I would love to be a distributor. If you have questions about being an affiliate, a distributor, as far as a distributor, I don't know if you're in an office or where you're at, but if you have any of those kind of questions, you know what? Let me get our email, the marketing email.
Yeah. Do you got it or do you want me to do it?
I don't know it offhand. I'm gonna look it up here real quick because I'm afraid I don't wanna. I got it now.
It's marketing at ProCare.
You got it, Brittany?
Yeah, it's marketing at
So you can call us, and our phone
ProCareNow.com.
number's on our website. I can copy and paste that, or you can email us. So that's everything. I want to just say goodbye, I guess. And do you have anything else, Brittany?
No.
Okay.
Thank you for being here, guys.
Thank you to our other affiliates, our coworkers, Aaron and Janine too, as well. Thank you, guys. Have a great evening. Be safe.
Bye.
Bye-bye.